and CEO of Impact Hub Newark Metropolitan area. Thank you so much for joining us for Impact State of Mind. We're very excited to have a great speaker for this session, Business Design and Tech Revolutions for Big Impact During Health Epidemics. We are welcoming Grace Lee, who is a serial entrepreneur and innovator. She is CEO of Health Enovations and founder of Million Patients Cured. Grace, it is so great to have you on today. First, I want to note for people who are coming on as attendees, feel free to ask questions throughout the presentation by looking at the Q&A icon on the bottom of your screen and adding there, and we'll be curating those for Grace to answer after the presentation. So with that, without further ado, I'm going to pass it over to Grace to tell us about how health epidemics change industries.
Well, thank you, JP, and thank you, Impact Hub, for hosting this event. We're very excited to talk to you about all the innovations and opportunities for every startup and every nonprofit organization out there. Just to give you a little bit about my background, over the last 25 years, I've been advising doctors, hospitals, pharma companies, biotechs, and government on how to develop new epidemic response strategies, business models, research, and data technologies for diseases such as HIV, cancer, depression, pain, diabetes, and immune disorders, and 116 other conditions. And what we've really looked at is the trends and how it impacts the world, especially in corporations and startups and in society. And what we've seen over the last few months is one little virus fundamentally changed the entire world. There is no going back to normal as we remembered it to be. And there are new problems and new normals to be established in the near future. The main revelation of the epidemic is that our healthcare system was not resourced or prepared to handle the surge. In March, there was plenty of problems with supply chain to meet the demand in terms of masks, gowns, gloves, and ventilators were in short supply. Healthcare workers themselves were also in limited supply, overworked, and taking on tremendous risk with limited protection. The low-income families and minority communities were at greater risk due to limited access to healthcare previously for preventable diseases such as diabetes and heart disease, which confer a much higher mortality. The elderly and vulnerable populations were the least capable of defeating the virus, and yet our proximity to them not only put them at risk, but also perpetuated the spread of disease. And even the doctor's office have to figure out how their staff can perform their services and not take on more risks when the patients arrive. Customer experience entirely has to be redesigned when people are quarantined, socially distanced, or masked. So if you look back in, let's say, 2015, if you are a startup trying to convince investors and doctors and patients to use telemedicine, you would be spinning your wheels. Because of quarantine, doctors needed telemedicine to provide basic diagnostics and even prescriptions for testing and drugs. So now the world has woken up to see that it is possible, trustworthy, and acceptable for remote medicine in light of major crises we all experience. So with this, I would like to invite all of you to get a piece of paper and a pen and just jot down some of the ideas of how you can pivot your business, nonprofit, or organization in order to address the new issues that are arising in the near future and to be able to be developing it live as the world is changing so that you're prepared to be the first to be there to provide the services, the processes, and the customer experience. So even if we look at right now from a scientific standpoint, scientists and doctors are scrambling to describe this novel and previously rare disease. Prior to 2020, there was very little government funding, attention, or public awareness of the value of research into Ebola, SARS, or H1N1. So now we can see why it's important that scientists continue to research diagnostics, cures, and prevention so that these global epidemics don't happen again, or at least we're much better prepared in the future. Considering that right now there are 14 countries petitioning for an independent council to look into the real source of the epidemic, the fear of biowarfare may become the newest form of weapon of mass destruction, and we can see the impact of one little virus that can be used against us in that way. So like 9/11 fundamentally changed the entire world, and especially in travel. In 2020, every single industry has to change normal for the future. We know that travel, hospitality, and healthcare were the most obvious industries impacted. But if you are looking at share economy, the Airbnbs and the Ubers, the gig economy, all the freelancers, retail, all the stores are now closing, influencer blogging, and co-working spaces are now no longer viable due to the epidemic. The epidemic crash and the corporate downsizing makes us think about, are workers really ready to pivot and become knowledge workers who are better able to work remotely? Let's talk about remote working. Remote working and online education is shown to be possible and less costly than the traditional ways of educating or working. Now we have an opportunity to determine how to make it even effective and more easily maintain the attention of students and workers. You know, one of the aspects or challenges that schools and teachers face is, how do you keep the children's attention onto a screen, or enable them to come back to school in half the capacity that they once had? With the proof of concept that remote working works, corporations now have realized that they don't have to pay for the expensive cubicle space in a crowded city anymore. So people are moving to the suburbs and less costly cities where they can work from home offices and not commute long distance on a daily basis. Real estate may downshift or crash in the next 6 months to a year due to foreclosures from all the unemployment. So we've already seen that in just 2 months, 400,000 people have left New York City, 71% reduction in new leases, mostly because the students have not come into the city as of May, for example, and 40% vacancy rate in the rentals. So with government, media, and the public, they did not have enough information to share with us. And even when they are sharing the information, it's not an easy to find way, easy to understand, or easy to track. When there's information, it's near impossible to interpret legal language for the typical user. So our team of data scientists have spent extensive amount of time searching and curating and interpreting and reporting on information that's very difficult to integrate. So the challenge is that in September, the flu season may bring on a new second corona wave when we haven't eradicated the disease like other countries have. This won't be the last epidemic or rare disease we will face. It took 40 years to find a vaccine for Ebola, and even HIV and cancer are still only treatable with a cocktail of symptom relievers, but not really cures. It took 10 years to understand what the new virus like HIV was doing to the human body, and another 10 years to come up with enough treatments to keep it under control. We won't be out and about fearlessly until at least 18 months of vaccine testing for safety. So this creates 2 years of opportunity to develop endless possibilities to reimagine and reinvent how humans can be empowered and connected, and the right information to be shared with them so they can make a choice that is best suited for them. The need for digital transformation have been accepted en masse while we were all on pause, and the change that would have taken 10 years through cultural resistance has within 2 months become essential. The world has woken up, and it's our time to change the new normal.
Wow, Grace, could you tell us more about how customer experience and data flow will determine what model survives the epidemic?
Sure, I think this is a great way for us to show you through example of how Million Patients Cured team had taken on this challenge starting from the day that the epidemic was deemed an issue for every state to address. So we looked at customer experience and how to design the right data flow to address it. On March 10th, it was clear to Million Patients Cured team that there was a huge need for customers to find masks and testing sites. Within 3 days, we launched the site to be able to enable leaders from 35 organizations to come together to solve the problem. Within 5 days, we had close to 500 testing sites online for any user to search. Within 10 days, we realized that there was a huge need for PPE, but not enough trustworthy suppliers to deliver to the hospital. So this is an example of a pilot and an iteration that others should be cognizant of is that while the world changes and reacts to something that was so unexpected like COVID-19, there was a lot of unknowns. And through the genuine effort of people wanting to bring supplies of PPE into this country, we discovered that fake certificates of FDA approval, scams, and high pricing became extortion of the government, of nonprofits and startups. PPE donations were being rejected because initially the PPE were either handmade or not FDA approved. The hospitals would not accept them because they did not have the traditional packaging or the brand of that were accepted by the hospital acquisition process. Eventually, the healthcare workers had to fend for themselves, and many of the organizations trying to do this work realized that there was competition between the federal level and the state levels for some of the same supplies. So that local effort, you couldn't even acquire the supplies if you wanted to. Lots of brokers were out there trying to negotiate deals, but very few buyers out there for the large pallets of supplies. So when we realized all this, we saw that that wasn't a problem that could be addressed in the near future, given the forces of regulations, of traditional buying behavior, and the competition. So we turned our attention to information flow. The information challenge of delivering 1,500 testing sites info and 750 research sites across 3,000 counties across the US, and to make it easy to access this information those who need it the most. By April 1st, we had launched a search engine. We created an interactive map of all the test sites so that it can be found by country, county, by state and county, and searchable by anyone with interactive clicking. So no typing and no drop-down menus. Because our persona and our target audience was that even grandmothers could use this. This did not entail any special skills to be able to look through a map and to find the information that you need with just one click. So our approach was very much trying to get the information to the user as easily as possible, so that when you zip down and you can see the information by sites and information by clinical trials, all within a fingertip. And by hovering and by seeing the information presented to you without typing at all. Below, what we've done by May 1st, the Million Patients Cured team has curated all the state mandates closing and reopening for all 50 states, updated weekly, and containing the most easily understood and accessible information than in any other state or county website. So you can see here, as you explore, you can see what the requirements are by state for schools, childcare, public, retail, restaurants, for covering, facial coverings or staying at home, for elective medical procedures, and by the different public areas and recreational areas and business types. And this type of exploration was able to integrate the information that was available but not very easily understood. And so by clicking on the county, then we can enable the search on a much more detailed basis for all the testing sites and the clinical trials that are available by each of the criteria that is required for the testing. So along the way, we realized that not only were testing sites and research sites difficult to acquire as along with the state mandates, the scientific article was confusing and too technical for the public. So our science team then curated and interpreted and rated 700 scientific publications and regulatory acceptances for diagnostic tests, immunity tests, drugs, and vaccines. So through this experience, we created an integrated information platform that empowered and connected the services and the data that each individual human needs to make an informed decision about their own life and about their health. The model that will survive in the future will entail creating value for the public or corporations through remote or distance digital transformations or channels. Customer experience for the public that has to be socially distanced, work or learn from home, or avoid large crowds and confined spaces. So basically every restaurant has to be reimagined, every corporation has to be reimagined. The data flow for the government, the media, the corporations, or even sales and communications has to be reinvented for virtual environments. If we look backwards in 2008, the real estate crash then saw the birth of the iPod, the Facebook, and social media, Pinterest, Uber, Airbnb, Slack, and Netflix. 2020 is already showing the power of Tesla self-driving cars and SpaceX going to space, Zoom, TikTok, and the migration to suburbs away from commutable cities. We, as a group of entrepreneurs and inventors, can determine what becomes the new normal. And anything manual that reverts back to the way we were will simply not survive.
Great. So what actions can impact community members, entrepreneurs, or otherwise take to address emerging needs and succeed in designing the new normal?
Yeah, very much. There's 4 main areas that every organization should consider how they would operate in the post-COVID world and how they can pivot ASAP. Number 1, figuring out how to address the problems and the opportunities in every industry presented by the virus. When I go into companies and governments to design strategies or businesses to respond to epidemics, I always look for how best to integrate the solutions so that the connections between people, products, services, and information are seamless. And it's a puzzle piece. You have those 4 components, and to figure out how best to integrate those components is really the winner, right? Through this epidemic, we have demonstrated that these 4 main areas need to have some significant social impact after the epidemic. Every industry is being disrupted now, and we have a chance to redesign it. So from a people-centric experience, looking at restaurants, how will we eat while socially distanced? How will we prevent and deliver the food, prevent the spread and deliver the food? Corporations, are there remote working, or is there going to be testing before entry of every employee? How are airlines going to operate, to maintain that distance? And how are hospitals and doctor services going to serve the patients? If we look at products, through the epidemic, a whole new industry has arisen in the similar way that the small bottles for toiletries came out of the 9/11, post 9/11 innovations. We've got, every business basically selling masks and sanitizers and building sneeze guards and basically separation curtains or surgical boxes for surgery or shields. We have lots of diagnostic tools being developed, at-home tools being developed, fever sensors, or even other immune boosters being investigated. And from a process standpoint, contactless transactions and remote working and distance learning, those are huge opportunities for innovation and disruption. And basically, if we look at what businesses thrived well, it's delivery of anything and everything to make it possible, just in case that we have to go through another shutdown in the fall and through winter. This is going to be your opportunity through the summer to develop that. And then in terms of information, the most fact-checked, integrated, curated, translated, transformed information so that the user can at home understand what's really going on out there and to be able to make their most educated, effective decisions. If we look at even as Twitter as an example, to put forth, the fact-checking capability makes them excel and drives the fact-hungry users to use Twitter in a much more trustworthy way. So what we see here is opportunity, and we hope that all organizations, startups, and nonprofits can take advantage of this through the next 3 months and really pivot and think about how to when the consumers come out of pause, that they can really benefit from that type of business structure or that type of business innovation. But thank you all for this opportunity to give you our ideas on how we can change the world. And we hope that everyone comes with great ideas in the next few months to show us what they can do with their businesses.
Thanks so much, Grace. So quick question. So first of all, what would you say to an entrepreneur who is thinking, well, everything will eventually go back to normal. I'm just going to wait and I'm going to sit on my hands and hope that everything will just be the way that it was before? What would you say
Yeah.
to someone like that?
That would be optimistic, and I hope that would be the case. But we've seen through the crash in 97, through 9/11, and through the '08 crash that recovery is not so simple. Each of those crashes took minimum 6 to 8 years to even come back to the economic levels of the previous years. And then fundamentally, things never went backwards. TSA was here to stay after it was developed. So if we look at each of the businesses, yes, you could consider that in 3 months, things may be back to normal, but then you missed the boat. And we have classic cases like Kodak thinking that no one would leave film industry, or Xerox, thinking that we're going to use copiers for the rest of our lives. And that's really the distinction between an innovator and someone who is risk averse because they think that the world is never changing. And I think those that have the courage and the attention to the changes that are happening throughout the world and thinking from a human's perspective are ultimately in the next years.
Got it. And from your perspective, because I know you're talking to experts all the time, how long do you think we're going to be going through the lockdown, unlockdown, lockdown, unlockdown? You mentioned earlier that this will be coming back again in flu season, and we'll have to deal with this once more. And there are a lot of implications for what that might mean for a lot of businesses.
Yeah.
What's your sense of how long this is going to be in a go no go situation?
Well, the typical answer to that question would have been how long is a piece of string, but I'm not going to use that answer. I think the real answer is how well do people comply? When you're dealing with a healthcare situation, compliance is the biggest determinant of whether you will be healthy and you will be suffering, or you will be suffering from the condition. If we look at it from a public health standpoint, it's the compliance of your entire community, your town, your city, to make sure that you don't catch the virus from somebody else in the community. And then if we're looking at on a country level, it's even harder because then it involves government and businesses and hospitals to have the capacity to meet the demand. If we look at countries like New Zealand, Iceland, there are small islands, they've been able to contain it. There literally is no virus on the island, but they've also closed the border to visitors. So they've created a world that enables them to resume back to normal by closing the borders and shutting down very early in the game. Unfortunately for the US, we didn't do that. And so with 50 states having different governors making decisions and individuals deciding whether or not, a mask or not to wear a mask. And so the big question here is, can we trust 300 million individual loving citizens to think about it from a community health standpoint? And even if we have 1 or 2 or 10 cases in our community come September, the outbreak will just simply happen again. So the real answer to the question is the empowerment of the people. And we see in California, Washington, and in New York that the citizens are empowered by their governors to make decisions, even if the businesses open up, even if beaches and parks open up. The behavior of the individual makes that difference. And so I hope everyone, all 300 million citizens, do take care of each other and do think about community health. But in reality, with flu season coming, we haven't gotten a handle on the flu season ever. So how we will be able to handle both at the same time is why all those maps from 1918 and 1968 with the previous outbreaks in the US have shown that the second wave is actually harder than the first. So the question is, are people going to comply and go back to their homes for quarantine, or are there going to be enough services and technology now that we've learned from the first wave to make the second wave a little bit more efficient and in a way bearable? And so it's on us in the next 3 months to create what that next wave is going to look like for those of us who believe in protecting community health and believe in empowerment of the individual to protect the community.
And so you mentioned earlier about how in previous crises we saw the emergence of these other companies that have come out, Airbnb, Uber, etc. So outside of the obvious, what kind of industries do you think maybe will have the most opportunity for entrepreneurs to really create new value that's, maybe not, specifically looking at a direct health outcome?
Yeah, I think that since we are not able to meet in person, since we are not able to be in a store, in a conference, in a co-working space anymore, any technology process, or service that involves empowering the human, connecting them to others so that they can get the building of trust and the building of relationships and to transact more easily through a process is going to win. Because at the end of the day, if you look at Uber, trusting that a random taxi driver or Uber driver does not have the virus is going to be a big hurdle for any sort of share economy. But if we look at people being quarantined at home and they need things, starting with toilet paper or sanitizer or, food or any sort of deliveries, services, everything needs to be delivered now. So a whole new crop of industries, companies like Instacart are going to do quite well. We already see that Amazon is doing quite well. Team and Zoom and Slack and anything that's remote, and even TikTok as a social release and a relief for individuals to get away from the more serious news and to find a haven for entertainment. Entertainment industry is going to have to reinvent itself. So I see that as long as people think about the human and design from a human perspective, any organization that thinks that way will win.
Got it. And Ms. Grace, I know that you are you're a New Yorker, but you're also across the world, traveling a lot during normal times and working in Africa and the Middle East and lots of places. So I'm curious to understand from your perspective what might be some of the international opportunities, also the entrepreneurs who may be based in the New York metropolitan area should be thinking about in terms of market size, because we know a lot of the virtual opportunities, it doesn't matter where you are.
Yeah. And I think that's a great point, is that the buyers, the clients, and the governments are now realizing that we can trust workers that are halfway around the world. So all of your insights and innovations that have worked in the US can easily be applied to every country around the world that is not at US level in terms of innovation technology. So I would encourage that you look at what works already well here in terms of actual technology and services and apply it to another region, because even for companies like Uber and Airbnb, they haven't reached Africa or Southeast Asia or South America yet. But those models work. Those models in terms of connecting the two buyers as a broker model, as an example, not necessarily share, but the ability to connect people as a broker, the ability to connect supply to demand is another area. So I can see the thinkers here, the knowledge workers here, be able to apply those ideas as a consultant or as a implementer of those services in any country. Commercial, when you look at abilities to address COVID, is much more limited than the US had and Europe has been able to do.
Great. Well, thank you so much, Grace, for your time. Really appreciate it. For people who are here with us live, there's a survey. If you can fill that out, it should have popped up on your screen. We appreciate that. And if anyone has any other questions, feel free to reach out to us at newark@impacthub.net. And we'll try to get some feedback from Grace or from others so we can get your questions answered. And please stay safe. And thank you so much, everybody, for coming on to the session.